non-stop local news.
Still ahead here on News Channel 8 Midday. Don't let this mild fall weather lull you into thinking that we are a long way away from flu season. We're going to be talking to a physician from MedStar Georgetown University Hospital about some ways that might help you avoid the flu.
It's that time of year. Cold and flu season is back. So how bad will it be this season? And what's the best way to protect yourself and your family? We brought in an expert today.
We sure have. Dr. Maria Aramburu is a pediatrician at MedStar Georgetown University Hospital. Welcome, Dr. Aramburu. Good to see you today.
Thank you for having me.
Yeah, so already we're seeing some coworkers sniffling, sneezing, that kind of thing going on. And in fact, we had our flu shots here at the station just yesterday.
Right.
But is there a way to?
Got one.
Yes, we did. Is there a way to sort of look at the season ahead and predict how bad it's going to be, how severe?
Well, right now we're seeing some sporadic cases, so it's basically started in DC, even with the nice weather. So we can't predict how bad it's going to be, but it definitely is coming. We're seeing some cases.
I think a common belief, myth maybe, is that if you get the flu shot, you're probably going to get sick with the flu in the first couple of days. Some people may feel symptoms, a headache or whatnot, but is that true?
Well, some people might feel some symptoms, but it doesn't mean that you're sick. It's your body building that defense against the virus. So it's actually something good, and it will pass quickly, and it's much better than being very, very sick with the flu.
I think some people just can't decide, is it a cold or is it the flu? What's the difference?
So a cold is an infection with a virus that causes respiratory symptoms, but the flu is a virus.
Also has the
it's a virus.
symptoms.
It has the symptoms, but it has the potential of getting much worse. We've seen deaths with the flu. People end up hospitalized, especially little kids and older people. And because the virus changes every year, your body doesn't have any immunity unless you get the vaccine. So then it has the potential of spreading really quickly and getting you in the hospital.
Let's talk about that. You are a pediatrician.
Yes.
I'm actually a new dad. And so for parents of young children, infants, what age should a child be getting protection from the flu?
So every person 6 months and older should get the vaccine. And we recommend, and CDC is recommending everybody to be vaccinated by October, by end of October. If it's the first time a baby's getting the vaccine, they need to get 2 shots, 4 weeks apart. If you've gotten it previous years, then you only get 1.
And for folks who work with babies that are younger than that, or people who have people in their family who have major allergies or have immune challenges, that herd immunity is so critical, isn't it?
It's so critical, especially caregivers and persons in contact with little babies or older people should get vaccinated because the babies cannot get the vaccine under 6 months, and the only way of protecting them is actually getting that vaccine so we can protect them from being exposed.
And some people who have certain allergies can't get the flu shot.
Yeah.
Like if you're allergic to eggs, for
Just egg.
example?
Yeah, just egg. But for immunosuppressed, people with asthma, special chronic diseases, cardiovascular, recommendation is to actually get the vaccine as soon as possible.
Something I've always wondered is that because this virus can mutate over time, is it better to get the vaccine now, or I've seen some people say it's better to wait later in the season than you're getting?
No, it mutates every year.
Okay.
So when the new season starts, we already are seeing the viruses that people are getting, and it has a good match with the vaccine that we're providing for this year. So last year the immunity was only 60%, but this year they're testing the virus, and the vaccine that was created for this year seems to have a good compatibility. So you probably will be more protected.
And
the earlier the better, because then you are preventing getting exposed, getting the disease.
And it takes a couple weeks for it to take effect.
Right. Yes, especially for babies that need the 2 shots, they should get it as early as possible because they have to wait 4 weeks.
Good insight.
And then always good to just wash your hands, right? And try to stay as healthy as you can.
Good hand washing, staying at home if you're sick, and going to the doctor, because if you do get the flu, you can get the Tamiflu, but it needs to be started within 48 hours.
And that helps to shorten the duration.
Shorten duration and the severity.
Sounds good to me. Well, good to talk to you. Thank you so much, Dr. Maria Aramburu with MedStar Georgetown. Appreciate your expertise.
Good health.
Yeah.
Thanks. Yeah.
Up next.